Hello everyone, welcome to EduTap and also welcome to the government scheme session. The scheme that we are covering today, it is in continuation with the last one. So in the last session we understood about a flagship scheme that is under the Ministry of Health and Family Welfare, and it was Ayushman Bharat Yojana, right? And in that we understood that in 2021, so basically this scheme was launched in 2018, which we have already discussed. There were two more components that were added in 2021, and those were Ayushman Bharat Health Infrastructure Mission and Ayushman Bharat Digital Mission, right? So in this particular lecture we are going to understand about these two components, what is this all about. But before that, here's an announcement for all the aspirants who are preparing for central regulatory bodies. We have come up with one-stop solution guide to all the queries that you must be having regarding the organization you want to join. For example, if you want to know about the functioning of RBI, NABARD, SEBI, you can refer to these e-guidebooks. Along with that, what will be your role once you join the organization, how does it contribute to GDP, everything has been comprehensively covered, along with the recruitment process. So what is the eligibility criteria, how many phases are there, what is the pattern of each phase, what sorts of questions are asked in each phase, what is the syllabus and what not. Whatever questions you have in your mind, everything has been comprehensively covered in these e-guidebooks, and let me tell you, these are free of cost. So do not miss the opportunity. You can download these e-guidebooks from the link that is provided in the description box below. Right. So now let's start off with the session, and this we have already understood about what was the basic aim of Ayushman Bharat, that is to provide the quality healthcare facilities, right? And along with the quality, we actually have to make them affordable, right? The facilities should be affordable only, and this was scheme all about. So it was the National Health Protection Scheme. And how are we going to protect the nation's health? That we will do by providing first of all quality facilities, and then it should be affordable also, so that people, they can actually take the benefit of these healthcare facilities, right? And we also understood in the last session that how there were initial two schemes that were running separately, and they were catering to the national health protection only. One was Rashtriya Swasthya Bima Yojana and one was Senior Citizen Health Insurance Scheme. However, these two were then merged when this particular scheme, Ayushman Bharat, was launched back in 2018, right? Now here we are going to understand about two components. So if you remember in the last session, we understood that how the government, they are going to establish 1,50,000 primary healthcare centers, right? And what was the aim behind it? The aim was to reduce the burden into the secondary and tertiary healthcare facilities. So why was it done? Again, we'll just have a quick revision. So basically what will happen, if you stop any disease at the very first stage, the person, the disease, it will not spread it to tertiary or maybe the secondary or tertiary level, right? So it was the aim. That is why that primary healthcare center should be established, so that the disease can be stopped, right, at the very early stages or the initial stages, or maybe they could diagnose at the initial stages. For example, if some person is they have cancer, right? So if it is diagnosed at the very first step, at least it would be cured early, right? So this was the aim behind it. Now what happened, even though the government is focusing to stop the diseases at the very first stage or the initial stages, but still there will be some people who would require the secondary care or the tertiary care, right? So in the first scenario that we understood that only primary health care was focused, then the government decided, and especially focusing during the COVID time, so then they decided that there should be a separate component which would individually focus on the healthcare infrastructure. So this infrastructure talks about primary, secondary and tertiary, all sorts of care, all sorts of facilities. Okay? Along with that, it will also research, it will do the research, and it would also focus on the surveillance of the disease spread, right? So that we can control it at a very smaller region only, and it should not spread to the further region, right? And if we talk about the Ayushman Bharat Digital Mission, so digital, it talks about, we know that everything is now being digitalized, right? So under this we will talk about that how bulky papers that you might have of all the health history, whatever you have, right? So all those bulky papers can now be reduced and everything can be online. Along with that, instead of going one to one just for the just to have a second opinion with the doctor, you can actually make online appointments also, right? So this is the aim behind these two schemes. So we will understand a little bit in detail of the two, of both the two, but there are some commonalities between two also. Let's understand that, right? For example, the launch year of both the components is 2021 only. So you have to understand Ayushman Bharat was launched back in 2018. However, two more components which were added were later on, which was your Ayushman Bharat Health Infrastructure Mission and Ayushman Bharat Digital Mission, and those were launched in 2021. Both will fall under, that's very simple to understand, Ministry of Health and Family Welfare. And we also know the implementing agency is your National Health Authority, that is at the national level, and State Health Authority at the state level. This we have understood in the previous session as well, right? Now let's individually talk about the scheme. So first of all is Ayushman Bharat Health Infrastructure Mission, right? So when so there was the earlier name, so again we know that there were schemes which were submerged, right? So this particular Abhim was, in a way, it was a part of Ayushman I'm sorry, Prime Minister Atmanirbhar Swasthya Bharat Yojana. Okay, so earlier name was this, but now it has been changed to Ayushman Bharat Health Infrastructure Mission. Okay. Total budget allocation of this particular component, if we talk about, so currently it has been launched in 2021, we have understood, and it is valid, like it has been launched till 25-26. The government aims to get the objective by 25-26. Later on it will decided that if the aim has not been achieved yet, then it might be extended, but currently it's still 25-26. And the total budget allocation means for these years, it is 64,180 crore. However, if we talk in terms of per year budget allocation that has been done, so the budget allocation, sorry, this should be 23-24. You will get the right one in the PDF, because this is for the latest one. So this is the latest budget, right? So for this year, 4,200 crore has been given for this particular scheme. And what is the objective? So objective we have already understood, that is to develop capacities of the health system. Okay, capacities means first of all to have good infrastructure, good they should have good machines over there, right? Good facilities should be there, and institutions, okay, at all levels. So this does not just focus on primary or secondary or tertiary, it is talking about all the three healthcare facilities, be it primary, secondary and tertiary. Okay, and on preparing health system, okay, in response to the whatever pandemics or disaster will come. So from the COVID we have understood that there can be situations like abrupted situations which were not expected, and there might be a burden on all the three sorts of, be it primary, secondary or tertiary infrastructure facilities, right? So we have to be prepared for such pandemics in future as well, right? So this is the objective. Apart from that, aim we have understood, and this I have told you as before, that IT enabled disease surveillance system will be developed under this. Okay, so this, because when we use information technology, or when we use the you can say the virtual modes, it become easier to propagate the information, it is easier to grab the information, right? So IT enabled disease surveillance system that will be made, okay, at all the level. Okay, एक network बनेगा, basically we have to develop a network, that is why it is at IT based. So a proper online network will be there, so that people basically the scientists over here, they can send the information and they can get to look at that if any disease is being spread or not, right? Similar the case that we have looked in corona. So basically if we look at it, the scheme was in response to what we faced during the corona. Okay, and the network that has to be set up, it will be set up in all the laboratories, surveillance laboratories that will be made at block, district, regional, or at even the national level also. Okay, and also we have to strengthen our health units. Wait a second, we have to strengthen our health units at the point of entry. What is this point of entry? So basically it means point of entry is from where someone is entering, right? So for example, it usually, like for example, it can be from the water modes. For example, somebody is entering India through ships, like for example somebody they gone for a job. For example, I'll just give basic example of merchant navy, like when the people they come back, they come through ships only, right? So that is their point of entry. People who go for traveling purpose, for studying purpose, for any purpose, for job purpose whatsoever, they enter India through the airports, right? So point of entry is from wherever the people they are entering. There also it should be proper surveillance system and health units we have to set up, so that we can diagnose if new disease is being emerging, and it can enter India at the point of entry only, so that we can reduce its spread, or we can prevent it spreading in the nation. Okay, and this will help us, of course all these things will help us to combat the public health emergency and diseases outbreaks. Okay, so I hope it is clear till now. And here increased investment, as we are looking at a lot of investment has been done in this sector. Of course, that is our response to the COVID-19 that we have faced. So these were the basics that you needed to understand. Now coming to Ayushman Bharat Digital Mission. So this we have understood, it talks about the digitalization. Okay, it had an earlier name, National Digital Health Mission, which is now a proper component. We have Ayushman Bharat Digital Mission, and here also we have budget allocation proper. So for the year 21-22 till 25-26, it is 1600 crore. However, we talk about this particular year, again this is for 23-24 only. I'll correct the PDF, that is rupees 341 crore. ठीक है, simple सा है. Aim क्या है? To provide digital health IDs. First of all, the aim is to have your digital health ID. In the last session, we have understood that all people who would come under the scheme, they would have their own ID card, and which was portable, like you can use all across the India, right? So whenever a person is using, right, so they would get some medicines, right, they would have some prescription that is given to them. Now it is very bulky to keep all these papers, and they might get displayed, right? So that is why to have a digital health ID, and it helps, it has all the your medical past history, which will even help the doctor to diagnose or maybe to give you a second thought in a proper manner, in a better manner, right? And along with that, तो एक तो provide digital health ID for all Indian citizens, ठीक है? एक तो उसमें ये होगा to help hospitals, insurance firms, for example, if your whatever be your disease, it comes under the insurance, right? So they would also have ease to look at the medical history, right? And citizen access health record electronically whenever that is required. ठीक है, so electronically so they can access it whenever they require. Features of Ayushman Bharat अगर देखें, ठीक है, इससे कुछ features है. First of all, इलेक्ट्रॉनिक एक आपकी ऑनलाइन हेल्थ आईडी बनेगी कंसिस्टिंग ऑफ ऑल द इंफॉर्मेशन, राइट? इट इज easier to access. Healthcare facilities and professional registry will also be part of Ayushman Bharat Digital Mission. Now this talks about if some particular private hospital caters to the features of this particular scheme. For example, if they accept the cases under PMJ Jan Arogya Yojana, which we have understood in the last session, all these information you can get it online, okay, in the Ayushman Bharat the official page that they are having, right? And whatever be the doctors, they want to be part of it, whoever doctor wants to be part of it, they can post themselves in these websites, so that the person, they can have knowledge, okay, this particular doctor is expertise in this, they are in the native region only, let's check there only, right? So these are facilities, all the information will be provided online, so it will give ease to the customer also to choose whichever the doctor they want to refer to, or whichever institute they want to go to. Okay, Ayushman Bharat Digital Mission Sandbox. So this is more of a technicality that comes under it. So basically what happens, there are constant updation that keeps on happening in a particular website, right? New features keeps on adding. So usually what happens, if at the back end, if they want to have some new features incorporated, usually the website, it stops working, right? So sandbox is kind of a, you can say, a buffer that is created. So here if the government, they want to do some experiment, they want to change some feature, they want to modify some feature, they can, in this buffer, in the sandbox, this is known as sandbox, they can actually make the changes and test the website, and the actual website, where if somebody wants to research something, or they are doing whatever on the site they are doing, right? So that is not impacted. So this is more of a technicality prospect than benefiting the citizen or maybe the healthcare facilities. Okay, and there's one more concept of e-Sanjeevani. So that is on the you can say tele communication. Here you can do with the doctors directly. So this is the virtual appointment that we are talking about. Okay, so यहाँ पे online you can talk to doctors, and you can discuss whatever disease, like whatever symptoms you have, and you can have the opinions from the doctor. If they would want to prescribe you some medicines regarding in relation to whatever be the symptoms that you have told, or whatever be the disease that you might have, so they can prescribe you online only. So you can do that. e-Sanjeevani is that platform, online platform, where you can have appointment with doctor sitting at your home only, you don't have to go anywhere. So this will also be, and this has also been included under the Ayushman Bharat Digital Mission. Okay, so these were the basics that you needed to understand. Now see, there will be constant updates, current affairs that keeps on happening in them. So from the examination perspective, because see, today only we have done this particular scheme, right? So at least for 3 to 4 months we are not going to touch that. But however, before examination, you have to be very thorough with all the current affairs that are associated with the schemes that we are doing, because more chances of them being asked in the examination along with the static, which we have already covered. Okay, now is a homework for you all who is the Minister of Health and Family Welfare. Very basic question. These are the toppers of the last session. So horrified, thank you. Sanjeev Kumar, we have Telegram channel, you can join that, and there you can get the PDF of all the lectures. Okay, Dixon said the right answer, and we have Kratika saying the right answer. We have Chetak saying the right answer, and we have Zexi saying the right answer. Right. So all of you, congratulations who has given the right answer. So that is all in this video. If you have any doubt, any query, please write to us. Please write. I'll definitely reply. And if you have any feedback, like which scheme you want me to cover, I have already some suggestion. However, you can add more so that we can make video on that. And you can join our Telegram channel to get the PDF of this and every lecture that we provide here on YouTube. So that is all in this video. We'll meet again with another scheme that is a news that is important from the examination point of view. Until then, all the very best for examination, and thank you.